Hello, I'm Chris Stout. I'm an endovascular and vascular surgeon with Ozark Regional Vein and Artery Center. Today, we're going to discuss May-Thurner Syndrome in addition to deep venous thrombosis and leg swelling with it. May-Thurner Syndrome is a kind of a neat diagnosis. It's an anatomic abnormality. Big fancy words again. Basically, the way our bodies are made and created, the vein in the pelvis, and veins are flimsy, as we've talked about in prior videos. The veins are very flimsy, and the arteries are nice and big and strong and robust, and they don't collapse because your blood pressure is, 120 or whatever it is. So that's the pressure of it. Your vein pressure is only at 30, so those can collapse. And in May-Thurner syndrome, in the pelvis, primarily on the left leg, but I've seen it on the right leg also. In the pelvis, that vein gets smushed or, compressed by the artery. And the vein is a very low flow, low pressure system, and that causes blood to stagnate or pool in the left leg. The symptoms of May-Thurner syndrome can go as drastic as deep venous thrombosis or DVT in one leg or the other. And it has to be a DVT that's at least from the femoral vein going down, the common femoral vein and down, and that can lead to PE or pulmonary embolism, and is one of the top 5 leading causes of death in the U.S. So it's not that this is uncommon. It probably affects about 20% of all people, but not everybody is symptomatic from it. So it's not a syndrome in everybody. Other symptoms that you can have from May-Thurner syndrome are your left leg aches or swells, and you can see varicose veins going across the pubic area or around the backside. And this would generally be worse, at nighttime, at the end of the day, once you've been up on your feet for quite a while. And it's kind of difficult to distinguish it from regular varicose veins of the leg or other problems. So generally, we'll try to remove the blood clot or get it debulked enough to where the flow can be normal. And then we go up into the iliac vein and see on that left side or even on the right side, see where it's smushed. And we can do a balloon angioplasty and look at the angioplasty and stenting video. It basically pushes it all open. And these veins are very inflamed. They're tender and they cause pain. And then we stretch these inflamed, sclerotic, scarred down veins. We stretch them open so blood can flow normally through them. Sometimes that will continue to be smushed, especially with the artery pushing on the vein. And we need to put a metal tubular stent inside that vein. And basically that stent is going to reinforce that vein. So you got that big, strong artery, you got that little floppy, weak vein, and that stent is going to make that vein nice and big and round. And it's something that's going to stay in there forever. So I don't take it lightly putting in stents in people, and I need to really be sure that it's appropriate for you. And whoever is treating you needs to be sure that it's appropriate for you, because it's not appropriate for everybody. And I think that being at Ozark Regional Vein and Artery Center, that's something that we can provide, and we can provide the expertise in whether or not this is a good treatment for you.